The lifelong impact of childhood trauma on health, understanding the far-reaching consequences. Childhood is meant to be a time of innocence, exploration, and growth. However, for far too many individuals, childhood is marred by experiences of trauma that can have profound and enduring effects on their health and well-being throughout their lives. Understanding the complex interplay between childhood trauma and long-term health outcomes is essential for providing effective support and interventions for those impacted by early adversity. 1. Physical health impacts. Childhood trauma has been linked to a myriad of physical health problems that can persist into adulthood. Research has shown that people who experience childhood trauma are at higher risk for chronic conditions such as cardiovascular disease, diabetes, obesity, and autoimmune disorders. The toxic stress of childhood trauma can dysregulate the body's stress response systems, leading to inflammation, hormonal imbalances, and impaired immune function that contribute to the development of these health problems later in life. 2. Mental health consequences. Childhood trauma is a significant risk factor for the development of mental health disorders, including depression, anxiety, post-traumatic stress disorder, PTSD, and substance use disorders. The emotional and psychological impact of childhood trauma can manifest in various ways, such as low self-esteem, difficulty regulating emotions, and maladaptive coping mechanisms. Left unaddressed, these mental health challenges can exacerbate the effects of trauma and significantly impair overall well-being. 3. Social and interpersonal effects. Childhood trauma can also shape individuals' social and interpersonal functioning across the lifespan. Trauma survivors may struggle with forming and maintaining healthy relationships, setting boundaries, and trusting others. The relational patterns established in response to childhood trauma can perpetuate cycles of dysfunction and lead to difficulties in establishing a support network and seeking help when needed. 4. Impacts on brain development. Growing evidence suggests that childhood trauma can alter brain development in ways that have lasting effects on cognition, emotion regulation, and behavior. Adverse childhood experiences, such as abuse, neglect, or parental substance abuse, can disrupt the formation of neural circuits involved in stress response, emotional processing, and executive functioning. These neurological changes can contribute to difficulties in attention, impulse control, and decision-making, increasing the risk of mental health disorders and substance abuse later in life. 5. Intergenerational transmission of trauma. Perhaps one of the most insidious aspects of childhood trauma is its potential to perpetuate cycles of trauma across generations. Trauma survivors may inadvertently pass on unresolved trauma to their children through disrupted attachment patterns, maladaptive coping mechanisms, and environmental stressors. Breaking the cycle of intergenerational trauma requires addressing the root causes of childhood trauma and providing support and resources for healing and resilience. The impact of childhood trauma on health across a lifetime is undeniable, but it is not inevitable. By recognizing the far-reaching consequences of childhood trauma and implementing trauma-informed interventions, such as therapy, social support, and holistic healthcare, we can mitigate its effects and promote healing and resilience in trauma survivors. Investing in early intervention and prevention efforts is crucial for breaking the cycle of trauma and fostering healthier outcomes for future generations. Together, we can create a world where every child has the opportunity to grow and thrive in safety and security.